Welcome back. Cortisol, often called the stress hormone, plays a key role in several essential body functions such as metabolism, immune response, and regulating blood sugar, or pressure rather. For any general practitioner, having a solid understanding of cortisol is important, especially given its connection to stress and long-term health conditions. And in this interview, we'll be getting insight from GP Nelson Makemba on how cortisol affects patients and what can be done to manage it. Dr. Makemba, good evening and welcome.
Good evening to you, Nina, and good evening to our viewers. And thank you for having me.
Thank you so much for being here. Doctor, to start with, break down for us what cortisol does in the body and how it, impacts your health overall.
Yeah, cortisol is a hormone. It's an endocrine organ-derived hormone. It's produced by an adrenal gland. They are sitting right on top of our kidneys. Often what really tends to happen is that it is released in our circulatory system in a response to a stressor, be it physical or psychological. For instance, if somebody is depressed and feeling down, sometimes the cortisol levels can go up. If somebody is having a chronic illness that is causing discomfort, pain, having had a fracture, overwhelming skin burns, and so forth. And what the hormone really does, it helps the body regulate itself in response to that, stressor. And what then tend to happen is that, if it goes up, for instance, it might cause some, changes such as increasing your blood pressure, for instance. It also causes, release of sugar into your circulatory system, and the sugar can go up. And oftentimes, really, people then tend to develop all kinds of presentation. They come with headaches, abdominal pain, nausea, diarrhea, erratic emotions, insomnia, not able to sleep, not able to concentrate, difficulty, with, eating and appetite, dropping and not sleeping very well. At times, ladies might even develop irregular periods. These are some of the clinical presentation, but, the list is quite endless.
When assessing a patient's stress, how do you evaluate the cortisol levels?
You can actually run a test. You can do a serum test where you can actually look for the levels in the blood. The one place they show up also is in the urine. You can also check for the cortisol levels in the urine and also in the saliva. It just depends on, the center where you find yourself and, what your lab is able to do for you. But those are the three parameters you can evaluate, either in the blood, in the urine, or in the saliva. And then you're able to then obviously referencing it off to what the lab references as normal, and I be able to see where the patient is standing.
Yeah. You mentioned quite a bit of symptoms there, but to narrow it down, for example, how would I know, that, my cortisol hormone could be an issue? What do I need to look out for?
First and foremost, we have to look at what triggers them to go up. For instance, are you maybe having a bit of a prolonged level of stress, be it psychological or physical? When that happens, the likelihood then is that, especially if you then have these symptoms where you are constantly not just feeling well, you are offish, you don't really seem to know where to place the problem, your emotions are not in place. One can then, look at evaluating the level of, your cortisol levels. I should say it's not something that we routinely do in clinical practice. Oftentimes, probably you might find, us evaluating the cortisol levels, when there's really a prolonged level of stress.
Right.
Now, when it's just a brief presentation where somebody's just a bit feeling not so well, maybe not having, we'll probably be geared at first treating the symptoms. And also at times, particularly physical stress, like I was highlighting to earlier, overwhelming skin burns, maybe if you're in a burn unit and somebody's admitted in a hospital setting, there you probably might be able to evaluate them properly, be it in the urine or even in the blood. And then you're able to tell really where the person is sitting in terms of the levels.
Are there any lifestyle changes that you recommend, doctor, that help, manage cortisol levels effectively?
Basic things like, just exercises. Remember, with exercises, you release endorphins, which is a feel-good hormone. It's actually the opposite of what cortisol sometimes does to you. So if you exercise very well, your cortisol levels are probably going to be at bay. Resting very well, just meaning, eating a healthy, balanced diet, relaxing techniques, meditation, those are the kind of non-pharmacological approaches that might actually, you know, impact one's level of cortisol. Just taking a self-care, knowing how to just juggle your routine, you know, taking some times off just to unwind and look after yourself and, you know, pamper yourself basically, where you feel a bit more confident, you feel good, you know, about the activities that you're engaging in. These are the kind of things that can actually help bring your cortisol levels. Over and above that, obviously, if we think you might need some medications, there can also be a pharmacological intervention where medications can be prescribed. For instance, if you are depressed, for instance, we give you something to help with the depression. And as you improve on that, you know, stressor being the depression, then the cortisol level also might end up improving as well.
How does high cortisol affect conditions such as diabetes or high blood pressure, doctor?
It actually worsens the condition because let's say, for instance, if you are diabetic and your cortisol levels goes up, and then you end up releasing more sugar into your bloodstream from your tissues. Already being diabetic, that might not be a good idea because then your sugar might become extremely high. And if that happens, you might end up developing a diabetic ketoacidosis, for instance, and if it's not picked up on time and promptly managed, that can actually be fatal. And we also know that higher level of cortisols might also increase your blood pressure. Now, already if you have a background of an ailment, which is a blood pressure, and your cortisol level goes up, your blood pressure then just increases further. And then obviously you can develop a hypertension crisis where the blood pressures are extremely high. That might also place you at risk of developing a stroke, for instance. Yeah, so if you do have these chronic ailments such as diabetes and high blood pressure, in the presence of higher cortisol levels, the outcome might not necessarily be a good one. You know, therefore, you know, a clinician need to be very careful in making sure that they manage you properly.
Any final remarks you'd like to leave us with this evening?
Yeah, all I want to say to our viewers tonight is that, you know, a good level of, you know, cortisols are needed. Remember, it's an endogenous steroid, and physiologically, you know, we need the cortisol levels. It probably becomes a problem when they are extremely high, but a good level is actually needed because that's how your body is able to respond effectively to the stressor that we're highlighting to. But if you find yourself constantly, you know, maybe feeling down, you know, you're probably going through a physical challenge or you have an emotional challenge, a loss of a loved one, you know, a breakup, a financial difficulty, all of these things tend to tip people over, and emotionally it can be depressing. So those are the type, you know, of, you know, challenges and seasons that people go through where their cortisol levels might go up. And it might actually then be warranted at that time, if one is worried, you know, to ask your doctor maybe if they can just test and see. I should highlight in our setting, for instance, in our country, we don't really have a practicing endocrinologist, meaning a doctor that specializes in hormone-related problems, you know. So that's why you find that at times perhaps most of these, you know, services are not really available. And one need to consciously think about looking further and testing cortisol levels when you're seeing patients. But one day, hopefully, if one of us or one of the young ones goes and specialize in this field, we could have these services at our, you know, shows, and then we could do better.
Dr. Makemba, we thank you for your time this evening. Thank you for being here.
Thank you for having me. It's always a pleasure being here.
We'll be right back after this brief break. The Daily Roundup with Nina continues.